Hi, this is Brittany Kavsak with the Animation and Ethics case study for APN 602, and it's our week 1 assignment. We watched a video that covered a case study on an older adult patient with a current tube feed. She is no longer wanting to continue the tube feed and has concerns with just being tied to it at this point. Her daughter has concerns as to whether or not she would get adequate intake if left on her own because of her severe dementia. However, there is no documentation or charting that lets us know actual diagnosis for the dementia. In this particular situation, we want to cover what the RD's role would be. First of all, one of the main goals of the dietitian in this situation is to help the patient receive adequate energy intake, whether that be through tube feed, oral intake. We really just want to look at making sure she's getting the right kind of nutrition for her needs. Also, his or her role is not to decide how nutrition will be received, but to offer guidance and knowledge to the patient in order for her to make an informed decision for herself. We don't come in with a bias of what we think we would want her to do. We want to give all the basic information, give our best advice, and then based on evidence, and then let her decide for herself. His or her role is also to educate the family member, the daughter in this case, on the intake method options being presented if the patient is requesting for the information to be shared. Many times older adult patients are wanting information shared with a loved one because that loved one is involved in their care, and they want to make sure all information is conveyed well and properly and nothing is left out. Another part of the role of the RD is to assess the patient for any potential malnutrition risks or physical showings of malnutrition, to set nutrition goals for the patient, and to create a care plan for this patient moving forward based on her wishes and desires. So what does the Code of Ethics for the Nutrition and Dietetics profession say about this particular case? How do we use these principles, the 4 principles outlined in the Code of Ethics, in this particular type of case study? Well, first of all, it is definitely an ethical issue, and we want to take a few variables into consideration before we go too far. The first thing I'd want to cover is, has the patient been deemed mentally incapable of making her own medical decisions? I have no firm data to conclude that that is accurate, only a daughter's casual mention. I would want to have data for that before we really moved too much further. If she has not had that kind of medical evaluation, I would want an evaluation done to support whether or not we want to put any decision making in the hands of the patient, which would be our first choice, or do we need to revise and put those decision making responsibilities into somebody else's hands, such as her daughter. I would also want to know if there's any documentation showing that the daughter, of all people, is in fact the person that could be making the decisions for this patient. Is there a POA in place that is not the daughter? And if so, we would want to look into that as well. In the Code of Ethics, there are 4 principles, as I alluded to. The first one is non-maleficence. This is going to really point out a few things in how it's related to this case. So first of all feeding recommendations that we're going to give to our patient should be based on evidence-based practices. We ask ourselves, are these methods proven successful in helping patients meet intake requirements? So when we calculate caloric needs, protein needs, we're basing this off of our own evidence-based practices. We also want to calculate the caloric and protein needs based on knowledge, as I mentioned. Consider and respect the desires, beliefs, and differences of the patient, and emphasize with the difficulty in making the decision to continue a tube feed or decline it. That is not a decision that we're going to take lightly. We want to empathize with this patient, understand that it is a difficult decision, and we really want to step back and respect whatever she desires, and work with her as best we can within that. We want to stay within our scope of practice as well. giving the appropriate nutrition recommendations and assessments while not overstepping into the other fields of healthcare workers also working on this case. Second principle I want to cover is autonomy. In working with the patient and her daughter, it is important to set aside any ideas on how we think the patient should be fed. Our own ideas or feelings about this aren't really that important. We realize our knowledge and clinical judgment are our guides, and our personal opinions are really not to influence our work at this point. We want to use clear explanations of the tube feed recommendations as well as potential advantages and disadvantages in regards to both the tube feed and oral intake methods. We want to give a big picture of what it's going to look like for this patient in both paths so that a wise choice can be made. Protect the patient's wishes. Her daughter is present, therefore it is assumed that permission has been given to disclose information to her. However, without being deemed incompetent, a POA or living will, the patient's desires for medical treatment will be respected. So at this time, without documentation proving to me otherwise, I want to honor the patient's wishes. I also am going to assume that the daughter is, in fact, been given permission to share with the daughter any medical information at this point. The third principle to be covered is beneficence. In this principle, we would want to take into consideration that we want to participate in conversations with both the patient and other healthcare workers assigned to this patient about the best options for the patient to receive adequate energy intake. So all conversations should really be focused on how are we going to get the best care for this person. We want to convene with other experts on her case to see if everyone is coming to the same conclusion for both competency and plan of care. Are we all on the same page as to her ability to choose for herself? Are we all on the same page as to the recommended plan of care? If not, we would want to discuss why and see if we can get on the same page. We also want to ensure that no personal opinions would have us responding in a negative way to the decisions that our patients make or the desires of the daughter. Our own personal feelings don't need to come into play, and we want to kind of watch our responses as they make these really tough decisions. When communicating with the patient and the daughter, we want to use appropriate terminology and explanations in order to be well understood, not just heard. We know that they can hear us, but if they're not really understanding the terminology, if we're speaking healthcare verbiage as opposed to layman's terms, we're going to be missed. And we want to convey all thoughts and all advice, recommendations, everything in layman's terms at this point. Lastly, we would talk about justice, the principle of justice. And under this principle, we would look at any potential environmental factors, such as low income or accessibility, that impacts the patient's decision. If she's feeling like she maybe is wanting to keep the tube feed in because she's not going to be able to make it to the grocery store, or she doesn't want to keep the tube feed in for fear of how expensive it might be or maintaining it, we want to help provide solutions for any identified obstacles at that point and help her make the decision not based on obstacles but based on best plan of care. So responding to the situation, if I was the RD in this situation, I would respond by saying, Mrs. X, I hear your concerns and completely understand your frustrations with being fed out of the bag. I'm relating. Mrs. X, or Miss X, I also understand your concerns for your mother's health if she chooses to have the tube removed. Mrs. X, there are concerns for you getting enough to eat without this tube. It is important that you are getting enough to eat to support your body's health and healing. Since you are feeling very strongly about having your tube removed, let's discuss what that may look like for you after you are discharged. Mrs. X, do you have any in-home assistance? Or are you currently living in a long-term care facility? If she said yes to either of those, I would say we will discuss nutrition recommendations with your care providers to ensure you're eating the recommended amounts. If there was no assistance of any kind, I would then say, would you like us to bring in our social worker to help you navigate possible options to help you ensure you are getting enough to eat once you are discharged? There are a lot of variables left unanswered, so it's difficult to come fully to an end conclusion in this case study. However, I would like to discuss the options further with the patient and her daughter to see if tube removal could be an option both parties would be comfortable with. I would also want to help my patient ensure adequate intake by offering options for accountability to make sure she is eating, such as in-home care that can come inside her home, but also be making sure she's eating enough that everybody is comfortable with her intake. Suggestions for meals or snacks that would fit her lifestyle. Sometimes those supplements can come in handy for someone who may find it difficult to make full meals. I would not force her to keep the tube or suggest that she listen to her daughter. I would not put that influence in for her. I would simply inform her, help problem solve, and allow her to make her own decisions. And again, if at any point I felt she was not able to make medical decisions for herself, or if I questioned her mental state, I would ask for a cognitive evaluation to be done to determine the best person to be making those medical care decisions moving forward. And these are my references, which both refer to the Code of Ethics for the nutrition and dietetics profession, as well as the mentioned case study. Thank you so much.